Hi, this is Dr. DocAmitay, registered clinical psychologist. Following this horrible tragedy in Connecticut where all these children and adults lost their lives, I've been asked numerous times, how should parents discuss such issues with their children or whoever's taking care of the children? So there are a few things to keep in mind. First, make sure you know the child's level of development, their cognitive development, their maturity. What can they handle? Number two, regardless of their age or their development, make sure you keep it short and simple. You don't give any unnecessary details. They don't need to know all the blood and gore. Number three, what they do need to know is that this is extremely rare. You have to keep repeating this. This is a rare incident. It's like an earthquake. It's like a hurricane. Unfortunately, they do happen, but they don't happen that often, especially things like these shootings. They're far less likely than an earthquake, for example. And so the child should not have this sense that there's danger or unpredictability or something like that lurking outside, because I'll tell you, very many of my patients with some kind of generalized anxiety issues report that growing up, whoever was taking care of them, almost daily or, quite frequently would spread these messages that made them feel that the world was this horrible, terrible, dangerous, unpredictable place. And as they grew up, they internalized the messages. So even as adults, if they know that it's not necessarily true, they still have remnants of those feelings and those fears. And it does compromise their functioning later on in life. So you don't want to impose that type of an issue onto your child. The other thing you have to do is please be very careful about the language. So many people are just tempted to say, well, someone went crazy and shot up the school. When you use words like that, crazy, you're basically stigmatizing people with any kind of mental health issue. Because a child can't necessarily discern someone who has gone psychotic, lost touch with reality, or somebody who may be a psychopath, or somebody who just snapped because of the stress that was imposed on them. Children don't know that, so all they hear is crazy. So what if the same child later on starts developing, for example, attention deficit disorder? Or what if they're depressed or they're anxious and now they're afraid to talk to their parents or other people because they're afraid of being labeled with that same crazy term and being stigmatized, just like they're hearing, for example, this shooter. So I'll have more to talk about these links with Asperger's syndrome and a lot of misinformation that's going on in a subsequent video.